Ayurveda. Greetings to all of you. Today we are going to talk about a little bit sensitive topic, that is erectile dysfunction or impotence. Erectile dysfunction defines as persistent inability to achieve or maintain penile erection sufficient for satisfactory sexual performance. In the past, erectile dysfunction was commonly believed to be caused by psychological problems. It is now known to be that most men erectile dysfunction is caused by physiological problems usually related to the blood supply to the penis. So let's see risk factors for erectile dysfunction. First one is aging. Second one, prostate problems. Then type 2 diabetes, hypertension, vascular diseases, high level of cholesterol levels and low level of HDL levels, and chronic sleep disorders, drugs, distortion or curvature of penis, inflammation of penis, depression, alcohol, lack of sexual knowledge and poor sexual techniques, and inadequate interpersonal relationship and smoking. It is estimated by the time a man reaches his 40s, he has about 40% chance of having erectile dysfunction. This prevalence increased about 10% for each additional decades. There are many possible treatments for erectile dysfunction, including medications, lifestyle changes, having a healthy diet, and reduce stress levels. Healthful diet. Eating a healthy diet rich in nutrients, rich food like fruits, vegetables, whole grains, and fish with fewer red and processed meat and refined grains has been shown to decrease the likelihood of erectile dysfunction. Sleep hygiene. When you are tired, it's difficult to maintain your sexual desire. Sleep deprivation affects your sex life in several ways. It reduces your sex drive, inability to get an erection, inability to perform or maintain an erection. One explanation is that testosterone is produced while you are sleeping. Low testosterone results in low sexual performance, lack of sleep. It also associates with obesity, depression, anxiety, and a lot of cardiovascular diseases, independent risk factor for erectile dysfunction as well. Lose weight. Losing weight is a health goal for many reasons. But can one of these reasons to be help cure erectile dysfunction? The short answer is yes. Maintain a healthy body weight, which is important because studies have found men who have 42-inch waist are 50% more likely to have erectile dysfunction than with the 32-inch waist. Studies have shown that excessive belly fat can cause an inability to get or maintain an erection. The endothelium, the small sheet of tissue that forms an interior lining of all our blood vessels, can be damaged by excessive belly fat. As a result, your body may not release enough nitric oxide, a molecule that signals the surrounding muscles to relax in order for the blood vessels to dilate and create an erection. Even more, carrying excessive weight can lower testosterone levels and raise level of female hormone estradiol, which further compounds the problem. Stop smoking. Smoking is an independent risk factor for erectile dysfunction because it causes vascular changes to the endothelium of blood vessels which interfere with nitric oxide production and signaling. Even more, many people smoke to reduce performance anxiety, unaware that they are exacerbating the problem. Quitting smoking may not reverse erectile dysfunction, but it contributes greatly to the improvement of penile function as well. Reduce alcohol. Drinking large amount of alcohol can make it difficult to get or keep an erection because
alcohol interferes with the messengers that tell the penis to fill with blood. Chronic alcohol use also interferes with testosterone production, the hormone that governs male sexual functions. Lower testosterone levels affect sperm production and sexual desire. So, reduce your alcohol intake to reduce the symptoms of erectile dysfunction.
Proper gapping is really important. Adequate gap between each intercourse is much important for sustaining an erection for the penis. Giving at least 4 days of gap after 2 consecutive intercourse is much essential. If performance anxiety is deemed the root of your erectile dysfunction problem, then sex therapy is great helpful. If you attend with your partner or choose you can go alone, although couple therapy has more benefits, added benefit, it helps your partner to understand and learn ways to support you. It is necessary to open up communication between you and your partner. Help to change ways negative thinking patterns toward sex. You and your partner receive information and education about sexual techniques, and your partner and you share responsibilities for helping solve the problem, even if it's due to a physical cause as well. Remember that erectile dysfunction is a complex psychosocial disorder. As an Ayurvedic doctor, I would like to advise all people with erectile dysfunction try to lifestyle changes and while they're seeking for normal diagnosis and treatments. For many people, lifestyle changes like eating a healthy diet and quit smoking, exercising, limiting stress, avoiding alcohol, and taking advice from your therapist can cure erectile dysfunction without taking a lot of medications. In my next video, I would like to share my knowledge with you about yoga techniques and natural remedies, how to cure erectile dysfunction. See you in my next video. Thank you for watching.